Hello everyone, family. Today we are going to talk about a very common shoulder ailment, which is rotator cuff tendinitis. It's quite a general thing because the rotator cuff is made up of 4 muscles. I'm going to show you the main tests to identify where shoulder pain might be coming from. These are very general tests, but several accumulations of positive tests can determine what condition we have. It is also important to understand that there are multiple shoulder injuries, calcifications, tendon tears, subacromial syndrome, adhesive capsulitis. The first muscle that often causes the most problems is the supraspinatus muscle. It's a small muscle that goes behind the scapula, above the scapular bone, passing through a small hole. And it inserts into the humerus over this area here. Test to see if it's the supraspinatus. We open laterally, and if the pain starts from 90 degrees upwards, it's an indicator of that the supraspinatus might be affected. Normally, the pain from here can radiate through the outer area of the arm. The Jobe's test consists of at 90 degrees. We move the arm slightly forward with the thumb pointing downwards. And we apply resistance downwards. If it hurts there, at this point the test is positive. It could be the supraspinatus that is affected. Approved. The second is the infraspinatus. It is also on the scapula below the spine of the scapula. That's why it's called infraspinatus, and it inserts a little more towards the back of the arm. One of those responsible for performing external rotations. Below the infraspinatus is the teres minor, which performs a function very similar to the previous one, the infraspinatus. Next test. This is to see if the infraspinatus is affected. Before it was the supra, now the infra. We place the elbows close to the ribs with a 90-degree flexion. Now I apply resistance and he tries to open outward. Open outward for me. There, if pain appears in the posterior part, the test is positive. Yes, but I never test positive. With the luck I have, well then you do it. 0.4, double the allowed limit. Another easier way to do it is we raise the arm to 90 degrees with the elbow flexed, and now we are going to do a rotation. If in this rotation, as if we were going to throw a stone. You throw back, it hurts. In the posterior part, that is, in this area here, the test is positive, and the infraspinatus may be affected. And another very important one, which is the main stabilizing muscle of the shoulder. It is the Subscapularis, which runs beneath the scapula, between the ribs and the scapula, and inserts a little more internally. Next test to see if the Subscapularis is affected, the one beneath the scapula. We place, with wrist, the hand behind the back. I apply resistance and ask him to push towards me. There, yes, pushing against me. He feels pain in the front area. The subscapularis muscle may be affected. The recommendations when you have this type of pain are first not to force your shoulder. That is, if opening the shoulder hurts. Do not continuously try to open the shoulder and move it only within the range of motion that does not cause pain. Then it is important to perform stretching exercises and release all the associated musculature. For that, I will leave you the next stretching video, which will indirectly help with the shoulder and the exercises that we are going to do next. It is also necessary to strengthen the muscles related to all the rotations and stability of the shoulder. And then, if with the physical therapy of release, with stretching, strengthening, and the therapy you do with your trusted physiotherapist, if all that does not resolve the problem, you must resort to chemical methods, anti-inflammatories, even injections, and in the most severe cases, surgery. In any case, if you have doubts, consult your doctor and they will guide you on which path to follow. Read the instructions for this medication and consult the pharmacist. The basic exercises for rotator cuff tendinitis are the ones we are going to tell you about now.